Last week, I did a talk for a group of massage therapy students at NHI. It was an Oncology 101 talk. So the conversation was about who is an oncology client, what are the most commonly occurring side effects, common ground and differences between short-term, long-term, and late effects following treatment, what are the primary modifications needed, and how long are those modifications needed for. And as always, when we have that conversation, the primary gist of the conversation was around lymphedema and lymphedema risk, because whether you're a massage therapist or whether you're an esthetician, the number one modification that you're going to need to make with clients in long-term survivorship is going to revolve around lymphedema risk. It is not possible to be a professionally practicing therapist and not to have these clients on your table. So that was the gist of the conversation that we had last week, and went well. After the Zoom was wrapped, though, I realized that there was a really important question that I had neglected to answer, and that is the reason for this video. So the question that I didn't answer that I wanted to is, during a professional credentialing program, what are the things that I can focus on at school that will serve me well, that will help me be a better therapist, that in particular will help me with my oncology practice, although not only oncology practice. So I'm going to approach that by providing 3 suggestions for you to focus on that you can bring into your experience of being at school and think about and work on while you're in the process of getting your certification. Those 3 things are, first off, the unseen connection, that of therapeutic presence. Therapeutic presence is the capacity to hold a healing space for another person with your calm and with your centered quality of being. It is a tangible experience to share with somebody in the room. Therapeutic presence requires that the therapist have internal coherence, and that is something that we all need to work on, whether at home or whether at work. Therapeutic presence, even though it's this tangible, intangible something, has value, has scientific data behind it. And to underscore the importance, the value of therapeutic presence, let me say that there is a hospital in Los Angeles, no names mentioned here, but there is a hospital in Los Angeles that we partner with, and since 2021 have been providing 3 programs every year for their clinical staff to be able to include integrative care modalities as part of their day-to-day patient-facing interaction. So these programs are offered 3 times a year. They're specifically for RNs. It's a 2-day program. During this 2-day program, there are 4 topics. One of those 4 topics has to do with therapeutic presence. This hospital is ranked as the 5th leading hospital in the US. The reason the hospital teaches their RNs about the value of therapeutic presence and how to engage in it during direct patient care is because therapeutic presence enhances the effectiveness of whatever technical skills you already have, and it leads to better patient outcomes. That is the reason why you would want to engage with therapeutic presence in your practice. Therapeutic presence is a rapport. It's a rapport that feels safe and steady, soothing, and reassuring. And ultimately, the benefit of therapeutic presence is like anything good in life. It benefits not only your client, it benefits you as well. It enhances how you feel about your work. It creates more value for you with your work. It's a regenerative feeling that you can take away from work with you. So the question that we're asking here is, what are the things that you can do at school during your credentialing program that will serve you well as a therapist once you're working in professional practice. The first one then is learn about therapeutic presence and how to engage with that in your practice. It's not something that you just wake up one morning and you can do. It is a practice and it takes practice. The second one is the value of verbal distraction. A word that is used a lot by massage therapists and estheticians is relax. They will ask their clients to just relax on the table. I advocate against that with an oncology client, with someone who is facing potentially impending mortality, inability to pay their bills, inability to understand whether they're going to get healthy again, frustration and disappointment about doing so many of the things right in life with regards to diet, lifestyle, and exercise, and relationships, and still being diagnosed with cancer, not being able to be a good partner or parent or effective at work, living with debilitating side effects as a result of the treatments that they're getting. For that person, the word relax is a loaded word, and it presents just one more opportunity for them to fail at something. More productive, I have found, has been to give someone specific direction that they can focus on. Maybe something that you could say. Client comes in, they're on the table, massage or skincare, and you're cradling their occiput in your hands. And it's the start of your service. So you're setting the intention for the practice, you're calming down whatever is happening in the room, and you say to your clients, I'm going to have you take a breath through your nose and then exhale through your mouth. You've just provided verbal distraction for them. You've given them direction. You've asked them to do something. Now you've given them an opportunity to take their mind off of what's happening on the outside and bring it into the space that you're in. Different verbal distraction that you could use for them. I'm going to have you take an inhalation through your nose, and when you exhale, you can choose your nose or your mouth, whatever feels best for you. When you exhale, I'm going to have you allow your body to rest a little heavier on the table. That's another way of saying relax. That's another way of asking them to soften their muscles, to lay your body just a little heavier on the table. We're humans. We respond well to simple directions, and it helps distract our mind from what's happening on the outside. Another verbal distraction that you could use, and actually this then contributes also ergonomically to body positioning in space, and almost every client I've ever seen on the table could benefit from this. Another verbal distraction to use is to ask the client to drop their chin half an inch or a couple of inches closer to their chest. And then when they do that, I say to them, my hands are cradling the occiput, either at the start of the facial, the start of the massage. When they do that, I say to them, see how that makes the back of your neck longer? And then as a therapist, I also understand the dynamic. I understand the dynamic that a crunched occiput leads to a forward tilt position with the hips, which leads to a scrunched low back. So that helps in general body comfort positioning overall, and making them aware of that I find is helpful. You know, when we're in a position of crisis, then there's a reason why there's the English saying of put your chin up and your best foot forward. And people do that when they're fighting through something. So being aware of what the body looks like on the table can lead to opportunities for positive verbal distraction as well, because that helps you replace the word relax, which presents just another opportunity for the client to fail, because sometimes it's impossible for them to relax, but they can follow your verbal directive of, of how to soften. So, in answering the question, What can you focus on during your foundational credentialing program that will help you be a better therapist to clients and oncology clients in particular? Value of therapeutic presence, verbal distraction as a tool, and then the ability to focus in on a 7 minute hand or foot massage. There are a number of reasons why a 7 minute hand or foot massage can be particularly helpful in your practice. Let's talk about peripheral neuropathy as a start. Peripheral neuropathy is neuropathy, which is nerve damage, which is happening in the periphery. And peripheral neuropathy is caused by many of the drug treatments, not all of them, but by many of them. And it's when the integrity of the myelin sheath, the fatty sheath around the nerve, is compromised. And for the clients, that can become the experience of numbness, tingling, feeling like walking on broken glass, inability to experience cold or heat sensations, inability to experience pressure, any number of different things. Sometimes it's incredibly painful, sometimes it's a numbness which happens. With some people with peripheral neuropathy, which affects primarily the fingers and the hands or the toes and the feet, sometimes it extends to part of the shins, sometimes it extends to part of the forearm. Most often, though, it's fingers and hands, toes and feet. Some clients will have it in both of them. Some clients will have it in only one. It's one of those lingering side effects following treatment. In other words, it starts during the drug treatments, and then when the drug treatments are over, it lingers longer. So, a benefit of being able to do a 7 minute hand or foot massage, of course, directly serves the clients who have peripheral neuropathy. There are other clients that it serves well, though. Sometimes you need something that you can bring into your 60 minutes or 75-minute service to pad out the time because there are body restrictions with the client you're working with. Clients, oncology clients who might have restrictions are, for example, clients who have had a recently implanted port and the décolleté, the pectoralis is a no-go area, or clients who have chest wall radiation burns, so tenderness, an area that we want to stay away from, or clients who have had recent breast surgeries or implants or reconstruction surgeries, or clients who have vital organ involvement, whether that's with regards to the treatments that they're going through or as an effect of disease progression. And you're looking for adjuncts that you can bring into your service that will take away from the long flowing strokes that you're doing, that will take away from the more demanding aspects of the service that you're doing. You want to bring something low key into your service time. So many reasons why a 7 minute hand massage or foot massage can be of benefit. So good reason to learn them. And when I say 7 minutes, I don't mean 7 minutes both hands. I mean 7 minutes one hand or 7 minutes one foot. You know, if we look at the hand, the thumb has 2 digits, but the other four fingers all have three. And they all have a 360-degree circumference. So there's a lot of real estate to work with there. So, in answer to the question, during your credentialing program, what are 3 things that you can focus on that will help you be better therapists once you are in professional practice? Developing therapeutic presence, developing your repertoire, your verbal repertoire with regards to verbal distraction, and being able to do an effective 7 minute hand or foot massage. If, as a therapist, oncology clients are going to be your focus, then access Society for Oncology Massage or Society for Oncology Aesthetics to find accredited education in your area. As a practicing therapist, it is not possible not to be working with clients who are on long-term survivorship, who either have lymphedema or risk for lymphedema. That is an education which you should prioritize getting as soon as possible, preferably before you graduate.